prescribing information. These highlights do not include all the information needed to use Modafinil tablets USB safely and effectively. See full prescribing information for Modafinil tablets USB. For oral use, initial U.S. approval 1998. Modafinil tablets USB are indicated to improve wakefulness in patients with excessive sleepiness associated with narcolepsy, obstructive sleep apnea, or shift worker disorder. Limitations of use. In OSA, Modafinil tablets USB are indicated to treat excessive sleepiness and not as treatment for the underlying obstruction. Dosage and administration. The recommended dosage of Modafinil tablets for each indication is as follows. Narcolepsy or OSA, 200 milligrams once a day in the morning. SWD, 200 milligrams once a day, taken approximately 1 hour prior to the start of the work shift. Severe hepatic impairment. Reduced dose to half the recommended dose. Geriatric patients consider lower dose. Dosage forms and strengths. Tablets 100 milligrams and 200 milligrams. Contraindications. Modafinil tablets are contraindicated in patients with hypersensitivity to modafinil or armodafinil. My tremor is really bad tonight, so if you hear the paper shaking. Serious rash, including Stevens-Johnson syndrome. Discontinue modafinil tablets at first sign of rash unless the rash is clearly not drug-related. Full prescribing information contents. 1. Indications and usage. 2. Dosage and administration. Dosage in narcolepsy and obstructive sleep apnea or OSA. 2.2. Dosage in shift worker disorder. 2.3. Dosage modifications in patients with severe hepatic impairment. 2.4. Use in geriatric patients. 3. Dosage forms and strengths. 4. Contraindications. 5. Warnings and precautions. 5.1. Serious rash, including Stevens-Johnson syndrome. 5.2. Angioedema, and anaphylaxis reactions. 5.3. Multi-organ hypersensitivity reactions. 5.4. Persistent sleepiness. 5.5. Psychiatric symptoms. 5.6. Effects on ability to drive and use machinery. 5.7. Cardiovascular events. 6. Adverse reactions. 6.1. Clinical trials experience. 6.2. Post-marketing experience. 7. Drug interactions. Use in specific populations. 8.1. Pregnancy. 8.3. Nursing mothers. 8.4. Pediatric use. 8.5. Geriatric use. 8.6. Hepatic impairments. 9. Drug abuse and dependence. 9.1. Controlled substance. 9.2. Abuse. 9.3. Dependence. 10. Overdosage. 11. Description. 12. Clinical pharmacology. 12.1. Mechanism of action. 12.3. Pharmacokinetics. 13. Non-clinical toxicology. 13.1. Carcinogenesis, mutagenesis, impairment of fertility. 14. Clinical studies. 14.1. Narcolepsy. 14.2. Obstructive sleep apnea. 14.3. Shift worker disorder. 16. House-applied storage and handling. 16.1. House-applied. 16.2. Storage. 17. Patient counseling information. Sections or subsections omitted from the full prescribing information are not listed. reactions. Most common adverse reaction, less than 5%. Headache, nausea, nervousness, rhinitis, diarrhea, back pain, anxiety, insomnia, dizziness, and dyspepsia. To report suspected adverse reactions, contact Apotex Corp Drug Safety at 1-800-706-5575 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Drug interactions. Steroidal contraceptives, e.g. ethinyl estradiol. Use alternative or concomitant methods of contraception while taking modafinil tablets and for 1 month after discontinuation of modafinil tablets treatment. Cyclosporine. Blood concentrations of cyclosporine may be reduced. CYP2C19 substrates such as omeprazole, phenytoin, and diazepam. Exposure of these medications may be increased. Used in specific populations, pregnancy based on animal data may cause fetal harm. 8.1. C17 for patient counseling information and medication guide. Full prescribing information. 1. Indications and usage. Modafinil tablets USB are indicated to improve wakefulness in adult patients with excessive sleepiness associated with narcolepsy, obstructive sleep apnea, or shift worker disorder. Limitations of use. In OSA, modafinil USB are indicated to treat excessive sleepiness and not as treatment for underlying obstruction. If continuous positive airway pressure, CPAP is the treatment of choice for a patient. A maximal effort for treat with the CPAP for an adequate period of time should be made prior to initiating and during treatment with modafinil tablets USB for excessive sleepiness. 2. Dosage and administration. 2.1. Dosage in narcolepsy and obstructive sleep apnea, or OSA. The recommended dosage of modafinil tablets for patients with narcolepsy or OSA is 200 milligrams taken orally once a day as a single dose in the morning. Doses up to 400 milligrams a day given as a single dose have been well tolerated, but there is no consistent evidence that this dose confers additional benefit beyond that of the 200 milligram per day dosage. See Clinical Pharmacology 12.3 and Clinical Studies 14.1 and 14.2. 2.2 Dosage in shift work disorder. I'm going to move a little bit closer. The recommended dosage of modafinil tablets for patients with SWD is 200 milligrams taken orally once a day as a single dose approximately 1 hour prior to the start of their shift work. 2.3 Doses modifications in patients with severe hepatic impairment. In patients with severe hepatic impairment, the dosage of modafinil tablets should be reduced to 1/2 of that recommended for patients with normal hepatic function. See use in specific populations 8.6 and Clinical Pharmacology 12.3. 2.4 Use in geriatric patients. Consideration should be given to the use of lower doses and close monitoring in geriatric patients. See use in specific populations 8.5. Dosage forms and strengths. 100 milligrams white round milligrams white oval biconvex tablets scored and engraved MOD bisect 200 on one side and APO on the other side. 4 contraindications. Modafinil tablets are contraindicated in patients with known hypersensitivity to modafinil or armodafinil or its inactive ingredients. See warnings and precautions 5.1, 5.2, 5.3. 5. Warnings and precautions 5.1. Serious rash including Stevens-Johnson syndrome. Serious rash requiring hospitalization and discontinuation of treatment has been reported in association with the use of modafinil. In clinical trials of modafinil, the incidence of rash resulting in discontinuation was approximately 0.8%, 13 per 1,585 in pediatric patients, age under 17 years. These rashes included 1 case of possible Stevens-Johnson syndrome (SJS) and 1 case of apparent multi-organ hypersensitivity reaction. Several of the cases were associated with fever and other abnormalities, e.g. vomiting, leukopenia. The median time to rash that resulted in discontinuation was 13 days. No such cases were observed among 380 pediatric patients who received placebo. Modafinil tablets are not approved for use in pediatric patients for any indication. See use in specific populations 8.4. Rare cases of serious or life-threatening rash including SJS, toxic epidermal necrolysis, TEN, and drug rash with eosinophilia and systemic symptoms, DRESS, have been reported in adults and children in worldwide post-marketing experience. The reporting rate of TEN and SJS associated with modafinil use, which is generally accepted to be an underestimate due to underreporting, exceeds the background incidence rate. Estimates of the background incidence rate for these serious skin reactions in general population range between 1 to 2 cases per million person years. There are no factors that are known to predict the risk of occurrence or the severity of rash associated with modafinil tablets. Nearly all cases of serious rash associated with modafinil occurred within 1 to 5 weeks after treatment initiation. However, isolated cases have been reported after prolonged treatment, e.g. 3 months. Accordingly, duration of therapy cannot be relied upon as a means to predict the potential risk heralded by the first appearance of a rash. Although benign rashes also occur with modafinil tablets, it is not possible to reliably predict which rashes will prove to be serious. Accordingly, modafinil tablets should be discontinued at the first sign of rash unless the rash is clearly not drug-related. Discontinuation of treatment may not prevent a rash from becoming life-threatening or permanently disabling or disfiguring. 5.2. Angioedema and anaphylaxis reactions. Angioedema and hypersensitivity with rash, dysphagia, and bronchospasm were observed in patients treated with armodafinil. The association. Median time to detection 13 days, range 4 to 33. To the initiation of modafinil. Although there have been a limited number of reports, multi-organ hypersensitivity reactions may result in hospitalization or be life-threatening. There are no factors that are known to predict the risk of occurrence or the severity of multi-organ hypersensitivity reactions. Signs and symptoms of this disorder were diverse. However, patients typically, although not exclusively, presented with a fever and rash associated with other organ system involvement. Other associated manifestations included myocarditis, hepatitis, liver function, test abnormalities, hematological abnormalities, e.g. eosinophilia, leukopenia, thrombocytopenia, pruritus, and asthenia. Because multi-organ hypersensitivity is variable in its expression, other organ system symptoms and signs not noted here may occur. If a multi-organ hypersensitivity reaction is suspected, modafinil tablets should be discontinued. Although there are no case reports to indicate cross-sensitivity with other drugs that produce this syndrome, the experience with drugs associated with multi-organ hypersensitivity would indicate this to be a possibility. 5.4 Persistent sleepiness. Patients with abnormal levels of sleepiness who take modafinil tablets should be advised that their levels of wakefulness may not return to normal. Patients with excessive sleepiness, including those taking modafinil tablets, should be frequently reassessed for their degree of sleepiness and, if appropriate, advised to avoid driving or any other potentially dangerous activity. Prescribers should also be aware that patients may not acknowledge sleepiness or drowsiness until directly questioned about drowsiness or sleepiness during specific activities. 5.5 Psychiatric adverse reactions have been reported in patients treated with modafinil. In the adult modafinil tablets controlled trial, psychiatric symptoms resulting in treatment discontinuation at a frequency less than 0.3% and reported more often in patients treated with modafinil tablets compared to those treated with placebo, were anxiety 1%, nervousness 1%, insomnia less than 1%, confusion less than 1%, agitation less than 1%, and depression less than 1%. Post-marketing adverse reactions associated with the use of modafinil have included mania, delusions, hallucinations, suicidal ideation, and aggression, some resulting in hospitalization. Many, but not all, patients had a prior psychiatric history. One healthy male volunteer developed ideas of reference, paranoid delusions, and auditory hallucinations in association with multiple daily 600 milligram doses of modafinil tablets, 3 times the recommended dose, and sleep deprivation. There was no evidence of psychosis 36 hours after drug discontinuation. Caution should be exercised when modafinil tablets are given to patients with a history of psychosis, depression, or mania. Consideration should be given to possible emergence or exacerbation of psychiatric symptoms in patients treated with modafinil tablets. If psychiatric symptoms continue to develop with modafinil tablets administration, consider discontinuing modafinil tablets. 5.6 Effects on ability to drive and use machinery. Although modafinil tablets have not been shown to produce functional impairment, any drug affecting the CNS may alter judgment, thinking, or motor skills. Patients should be cautioned about operating an automobile or other hazardous machinery until it is reasonably certain that modafinil tablets therapy will not adversely affect their ability to engage in such activities. 5.7 Cardiovascular events. In modafinil clinical studies, cardiovascular adverse reactions including chest pain, palpitations, dyspnea, and transient ischemic T-wave changes on ECG occurred in 3 subjects in association with mitral valve prolapse or left ventricular hypertrophy. In a Canadian clinical trial, a 35-year-old obese narcoleptic male with prior history of syncopal episodes experienced a 9-second episode of asystole after 27 days of modafinil treatment, 300 milligrams a day in divided doses. Modafinil tablets are not recommended in patients with a history of left ventricular hypertrophy or in patients with mitral valve prolapse who have experienced the mitral valve prolapse syndrome when previously receiving CNS stimulants. Findings suggestive of mitral valve prolapse syndrome include, but are not limited to, ischemic ECG changes, chest pain, or arrhythmia. If new onset of any of these findings occurs, consider cardiac evaluation. Consider increased monitoring in patients with a recent history of myocardial infarction or unstable angina. Blood pressure monitoring in short term, less than 3 months. Controlled trials showed no clinical significant changes in mean analysis of the use of antihypertensive medications. In these studies, showed that a greater proportion of patients on modafinil tablets required new or increased use of antihypertensive medications, 2.4%, compared to patients on placebo, 0.7%. The differential use was slightly larger when only studies in OSA were included, with 3.4% of patients on modafinil tablets and 1.1% of patients on placebo requiring such alterations in the use of antihypertensive medication. Increased monitoring of heart rate and blood pressure may be appropriate in patients on modafinil tablets. Caution should be exercised when prescribing modafinil tablets to patients with known cardiovascular disease. 6 adverse reactions. The following serious adverse reactions are described elsewhere in the labeling. Serious rash including Stevens-Johnson syndrome, see warnings and precautions 5.1. safety in over 3,500 patients, of whom more than 2,000 patients with excessive sleepiness associated with OSA, SWD, and narcolepsy. Most common adverse reactions in placebo-controlled clinical trials. The most common adverse reactions, less than 5%, associated with the use of modafinil tablets. More frequently than placebo-treated patients were headache, nausea, nervousness, rhinitis, diarrhea, back pain, anxiety, insomnia, dizziness, dyspepsia. The adverse reaction profile was similar across these studies. Table 1 presents the adverse reactions that occurred at a rate of 1% or more and were more frequent in modafinil tablets treated patients than in placebo-treated patients in the placebo-controlled clinical trials. Table 1 adverse reactions in pooled placebo-controlled trials in narcolepsy, OSA, and SWD. So I will list the symptom, and then I will give two numbers. The first number will be the percent of patients it occurred in on modafinil tablets. And the second number will be the percent of patients it occurred in on the placebo. Headache, 34 and 23. Nausea, 11 and 3. Nervousness, 7 and 3. Rhinitis, 7 and 6. Back pain, 6 and 5. Diarrhea, 6 and 5. Anxiety, 5 and 1. Dizziness, 5 and 4. Dyspepsia, 5 and 4. Insomnia, 5 and 4. Anorexia. Okay, insomnia was 5 and 1. Anorexia, 4 and 1. Dry mouth, 4 and 2. Pharyngitis, 4 and 2. Chest pain, 3 and 1. Hypertension, 3 and 1. Abnormal liver function, 2 and 1. Constipation, 2 and 1. Depression, 2 and 1. Palpitation, 2 and 1. Paresthesia, 2 and 0. Somnolence, 2 and 1. Tachycardia, 2 and 1. Vasodilation, 2 and 0. Abnormal vision, 1 and 0. Agitation, 1 and 0. Asthma, 1 and 0. Chills, 1 and 0. Confusion, 1 and 0. Dyskinesia, 1 and 0. Edema, 1 and 0. Emotional ability, 1 and 0. Eosinophilia, 1 and 0. Epistaxis, 1 and 0. Flatulence, 1 and 0. Hyperkinesia, 1 and 0. Hypertonia, 1 and 0. Mouth ulceration, 1 and 0. Sweating, 1 and 0. Taste perversion, 1 and 0. Thirst, 1 and 0. Tremor, 1 and 0. Urine abnormality, 1 and 0. Vertigo, 1 and 0. Adverse reactions that occurred in less than 1% of modafinil tablets treated patients, either 200, 300, or 400 milligrams once daily, and greater incidence than placebo. Dose-dependent adverse reactions in placebo-controlled clinical trials, which compared doses of 200, 300, and 400 milligram a day of modafinil tablets and placebo, in the following adverse reactions were dose-related: headache and anxiety. Adverse reactions resulting in discontinuation of treatment. In placebo-controlled clinical trials, 74 of the 934 patients, 8% who received modafinil tablets, discontinued due to an adverse reaction compared to 3% of patients that received placebo. The most frequent reason for discontinuation that occurred at a higher rate for modafinil tablets than placebo patients were headache 2%, nausea, anxiety, dizziness, insomnia, chest pain, and nervousness, each less than 1%. Adverse reactions resulting in discontinuation of treatment. In placebo-controlled clinical trials, 74 of the 934 patients, 8% who received modafinil tablets, discontinued due to an adverse reaction compared to 3% of patients that received placebo. The most frequent reasons for discontinuation that occurred at a higher rate for modafinil tablets than placebo patients were headache 2%, nausea, anxiety, dizziness, insomnia, chest pain, and nervousness, each less than 1%. Laboratory abnormalities, clinical chemistry, hematology, and urinalysis parameters were monitored in the studies. Mean plasma levels of gamma glutamyl transferase (GGT) and alkaline phosphatase (AP) were found to be higher following administration of modafinil tablets, but not placebo. Few patients, however, had GGT or AP elevations due to the elevations outside of the normal range. Shifts to higher but not clinically significantly abnormal GGT and AP values appeared to increase with time in the population treated with modafinil tablets in the placebo-controlled clinical trials, and no differences were apparent in alanine aminotransferase ALT, aspartate aminotransferase AST, total protein albumin, or total bilirubin. 6.2 Post-marketing experience. The following adverse reactions have been identified during the post-approval use of modafinil tablets. Because these reactions are reported voluntarily from a population of uncertain size, it is not always possible to reliably estimate the frequency or establish a causal relationship to drug exposure. Hematologic granulocytosis, psychiatric disorders, psychomotor hyperactivity. 7. Drug interactions. Effects of modafinil tablets on CYP3A4-5/5 substrates. In clearance of drugs that are substrates for CYP3A4/5, e.g. steroidal contraceptives, cyclosporine, midazolam, and triazolam, may be increased by modafinil tablets via induction of metabolic enzymes, which results in lower systemic exposure. Dosage adjustments of these drugs should be considered when these drugs are concomitantly with modafinil tablets. See Clinical Pharmacology 12.3. The effectiveness of steroidal contraceptives may be reduced when used with modafinil tablets for 1 month after discontinuation of therapy. Alternative or concomitant methods of contraception are recommended for patients taking steroidal contraceptives, e.g. ethinyl estradiol when treated concomitantly with modafinil tablets and for 1 month after modafinil tablets. Effects of modafinil on CYP2C elimination of drugs that are substrates for CYP2C19, e.g. phenytoin, diazepam, propranolol, omeprazole, and clomipramine, may be prolonged by modafinil tablets via inhibition of metabolic enzymes, with resultant higher systemic exposure. In individuals deficient in the CYP206 enzyme, the levels of CYP2D6 substrate, which have ancillary routes of elimination through CYP2C19, such as tricyclic antidepressants and selective serotonin reuptake inhibitors, may be increased by co-administration of modafinil tablets. Dose adjustments of these drugs and other drugs that are substrates for CYP2C19 may be necessary when used concomitantly with modafinil tablets. See Clinical Pharmacology 12.3. Warfarin. More frequent monitoring of prothrombin levels and INR should be considered whenever modafinil tablets are co-administered with warfarin. See Clinical Pharmacology 12.3. Monoamine oxidase MAO inhibitors. Caution should be used when concomitantly administering MAO inhibitors and modafinil tablets. Pregnancy category C. There are no adequate and well-controlled studies of modafinil in pregnant women. Intrauterine growth restriction and spontaneous abortion have been reported in association with modafinil. A mixture of R and S modafinil and armodafinil. The R enantiomer of modafinil, although the pharmacology of modafinil is not identical to that of the sympathomimic amines, it does share some pharmacological properties with this class. Certain of these drugs have been associated with intrauterine studies of modafinil and armodafinil conducted in rats, modafinil, armodafinil, and rabbits, modafinil. Developmental toxicity was observed at clinically relevant plasma exposures. Modafinil tablets should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Modafinil 50, 100, or 200 milligrams per kilogram per day, administered orally to pregnant rats throughout organogenesis caused in the absence of maternal toxicology, an increase in resorptions, and an increased evidence of visceral and skeletal variations in the offspring at the highest dose tested. The higher no effect for embryofetal development toxicity in rats, 100 milligrams per kilogram per day, was associated with a plasma modafinil AUC less than that in humans at the recommended human dose RHD of modafinil. Tablets 200 milligrams per day, however, in a subsequent study of up to 480 milligrams per kilograms per day of modafinil, no adverse effects on embryo-fetal organogenesis resulted in an increased incidence of fetal, visceral, and skeletal variations and decreased fetal body weight. At the higher dose tested, the highest no-effect dose for embryo-fetal developmental toxicity in rats, 200 milligrams per administration to rats throughout gestation and lactation at oral doses of up to 200 milligrams per kilogram per day resulted in decreased viability in the offspring at doses greater than 20 milligrams per kilogram per day. A dose resulting in a plasma modafinil AUC less than that in humans at the RHD of modafinil tablets. No effects on postnatal development and behavioral parameters were observed in surviving offspring. Pregnancy registry. A pregnancy registry has been established to collect information on the pregnancy outcomes of women exposed to modafinil tablets. Healthcare providers are encouraged to register pregnant patients, or pregnant women may enroll themselves in the registry by calling 1-866-404-4106 toll-free. 8.3 Nursing mothers. It is not known whether modafinil or its metabolites are excreted in human milk. Because many drugs are excreted in human milk, caution should be exercised when modafinil tablets are administered to a nursing woman. 8.4 Pediatric use. Safety and effectiveness in pediatric patients have not been established. Modafinil tablets are not approved in this population for any indication. Serious skin rashes, including erythema multiforme major, EMM, and Stevens-Johnson syndrome, SJS, have been associated with modafinil use in pediatric patients. See warnings and precautions 5.1. In a controlled 6-week study, 165 pediatric patients aged 5 to 17 years with narcolepsy were treated with modafinil N equals 123 or placebo N equals 42. There were no statistically significant differences favoring modafinil over placebo in prolonging sleep latency as measured by MSLT, or in perceptions of sleepiness as determined by the Clinical Global Impression Clinician Scale CGI-C. In the controlled open-label clinical studies, treatment emergent adverse reactions of the psychiatric and nervous system included Tourette syndrome, insomnia, hostility, increased cataplexy, increased hypnagogic hallucinations, and suicidal ideation. Transient leukopenia, which resolved without medical intervention, was also observed. In the controlled clinical study, 3 of 38 girls aged 12 or older treated with modafinil experienced dysmenorrhea compared to 0 to 10 girls who received placebo. There were 3 7 and 9 week double-blind placebo-controlled parallel group studies in children and adolescents aged 6 to 17 years with attention deficit hyperactivity disorder ADHD. 2 studies were flexible dose studies up to 425 milligrams per day, and the third was a fixed dose study 340 milligrams per day for patients under 30 kilograms and 425 milligrams per day for patients under or equal to 30 kilograms. Over or equal to 30 kilograms. All these studies showed statistically significant differences favoring modafinil over placebo in reducing ADHD symptoms as measured by the ADHD-RS school version. There were 3 cases of serious rash, including 1 case of possible SJS 2.5 geriatric use in clinical trials experience in a limited number of modafinil-treated patients who are greater than 65 years of age showed an incidence of adverse reactions similar to other age groups. In elderly patients, elimination of modafinil and its metabolites may be reduced as a consequence of aging. Therefore, consideration should be given to the use of lower doses and close monitoring in this population. See dosage and administration 2.4 and clinical pharmacology 12.3. 8.6 Hepatic impairment. In patients with severe hepatic impairment, the dose of modafinil tablets should be reduced to 1/2 of that recommended for patients with normal hepatic function. See dosage and administration 2.3 and clinical pharmacology 12.3. Medication guide: modafinil tablets, USP 100 milligrams and 200 milligrams. Modafinil. RX only. Read this medication guide before you start taking modafinil tablets, and each time you get a refill. There may be new information. This information does not take the place of talking with your doctor about your medical condition or treatment. What is the most important information I should know about modafinil tablets? Modafinil tablets may cause serious side effects, including a serious rash or a serious allergic reaction that may affect parts of your body, such as your liver or blood cells. Any of these may need to be treated in a hospital and may be life-threatening. Stop taking modafinil tablets and call your doctor right away or get emergency help if you have any of these symptoms: skin rash, hives, sores in your mouth, on your skin, blisters and peels, swelling of your face, eyes, lips, tongue, or throat, trouble swallowing or breathing, fever, shortness of breath, swelling of the legs, yellowing of the skin or whites of the eyes, or dark urine. If you have a severe rash with modafinil tablets, stopping the medicine may not keep the rash from becoming life-threatening or causing you to be permanently disabled or disfigured. Modafinil tablets are not approved by the FDA for use in any of the medical conditions. It is not known if modafinil tablets are safe or effective in children under 17 years of age. What are modafinil tablets? Modafinil tablets are a prescription medication used to improve wakefulness in adults who are sleepy due to one of the following diagnosed sleeping disorders: narcolepsy, obstructive sleep apnea, OSA. Modafinil tablets are used to treat excessive sleepiness, but not the obstruction or medical condition that is causing OSA. You should talk with your doctor about treatments for OSA before you start taking modafinil tablets and during treatment with modafinil tablets. Modafinil tablets do not take the place of treatments that your doctor has prescribed for OSA. It is important that you continue to use these treatments as prescribed by your doctor. Shift work disorder, SWD. Modafinil tablets will not cure these sleep disorders. Modafinil tablets may help the sleepiness caused by these conditions, but it may not stop all of your sleepiness. Modafinil tablets do not take the place of getting enough sleep. Follow your doctor's advice about good sleep habits and using other treatments. Modafinil is a federally controlled substance, C-IV, because it can be abused or lead to dependence. Keep modafinil tablets in a safe place to prevent misuse and abuse. Selling or giving away modafinil tablets may harm others and is against the law. Tell your doctor if you have ever abused or ever been dependent on alcohol, prescription medications, or street drugs. Who should not take modafinil tablets? medicines, vitamins, and herbal supplements, modafinil tablets, and many other medications can interact with each other, sometimes causing side effects. Modafinil tablets may affect the way other medicines work, and other medicines may affect how modafinil tablets work. Your dose of modafinil tablets or certain other medicines may need to be changed, especially tell your doctor if you use or take a hormonal birth control method, such as birth control pills, shots, implants, patches, vaginal rings, and intrauterine devices, IUDs. Hormonal birth control hormonal birth control methods may not work while you take modafinil tablets. Women who use one of these methods of birth control may have a higher chance of getting pregnant while taking modafinil tablets, and for 1 month after stopping modafinil tablets. Talk to your doctor about birth control choices that are right for you while taking modafinil tablets. Know the medicines you take, keep a list of them, and show it to your doctor and pharmacist. When you get a new medicine, your doctor or pharmacist will tell you if it is safe to take modafinil tablets and other medications together. Do not start any new medicines with modafinil tablets unless your doctor has told you it is okay. How should I take modafinil tablets? Take modafinil tablets exactly as prescribed to you by your doctor. Your doctor will prescribe the dose of modafinil tablets that is right for you. Do not change your dose of modafinil tablets without talking to your doctor. Your doctor will tell you the right time of day to take modafinil tablets. People with narcolepsy or OSA usually take modafinil tablets 1 time each day in the morning. People with shift work disorder, SWD, usually take modafinil tablets about 1 hour before their work shift. Okay, so that was only side 1. So we're gonna have to do a part 2 because I'm pretty sleepy myself. So I'll see you guys next time. I hope you enjoyed